What are the best physical therapy exercises for lower back pain? Number one, lumbar spine slash glute work. This is good mornings, hip thrusts, and back extensions. Number two, carries and marches. This could be a suitcase carry, farmer's carry, or kettlebell front rack carries. Number three, single-legged strength. This would be single-legged deadlifts, lunges, and step-up variations. Number four, anterior core work. This could be crawls, ab wheel work, or plank variations. Number five, lateral core work, like side bridges and pillar holds. Number six, rotational core work, like renegade rows and anti-rotation presses. So here's the thing. If you just want to see demos of all of these exercises, there's a link in the show notes to check out an article that has all of my favorite physical therapy exercises for low back pain. Okay. If you want to hear about why I like these exercises, then keep listening. All righty. So one, lumbar spine work and glute work. This is going to be good mornings, hip thrusts, and back extensions. Okay. So why do I love these exercises? Well, it's basically like medicine for the lower back. When we do these movements, it directly stresses the spine. If you've ever done good mornings before, you'll know, like, hey, this is pretty intense on the lower back. I have people tell me all the time, like, I am having a hard time feeling my hamstrings in the good morning. I just feel it all in my back. And I'll respond with, hey, don't worry about that. We actually want the lower back to be working a lot. You don't have to feel everything in the hamstrings. Are the hamstrings working? Yes. But tell you what, the low back is doing a ton of work there, right? And obviously, if someone's super irritable, they're probably not going to be able to handle a good morning. But over the course of time, once they're able to handle it, I want to throw the good morning at them just because it's going to directly stress the spine. And that stress to the spine is very similar to what we're trying to get back to, which is squats and deadlifts, right? So on the spectrum of hardest exercise to easiest exercises, like I said, the good morning is probably the hardest, followed by the back extension and finally hip thrusts. So most folks in low back pain can tolerate at least one of these exercises on the spectrum. If you're highly irritated, maybe you're doing hip thrusts and glute bridges. And as we start to get better over the course of time, we work our way up to back extensions and finally good mornings. Number two, carries and marches. So I love farmer's carries, suitcase carries, kettlebell front rack carries. If you have access to it, a yoke carry is great as well, right? All sorts of carries are phenomenal for low back pain. Now, why is this? Well, first and foremost, the carries are really great for working your lateral core. So what I'm talking about are the obliques, the quadratus lumborum, your spinal extensors unilaterally. So basically, when you hold a weight, let's talk about a suitcase carry. The weight's trying to pull you down to the floor, and your spinal extensors on one side have to fire to keep that from happening. And lastly, the glute medius, which same thing, your glute medius on one side has to fire hard when you're on one leg. Okay. And all of these muscles are important in low back pain. And the reason why I like carries so much is they're generally well tolerated. So if you have a spine that's pretty irritated, oftentimes you can pick up some weights. Your torso is very upright. It's not that challenging on the spine and get away with some walking, marching, all the like. So I love applying these exercises to my patients with low back pain. Number three, single leg strength work. Now this would be single legged deadlifts, lunges, and step ups. So why do I love these exercises? So first and foremost, it allows you to continue doing lower body strength training. Okay. And that's really important. When we have an injury, we don't want to stop training, right? And lower body strength training, if we do single legged stuff, is oftentimes not that irritating to the spine and allows us to accomplish that goal, right? It's better tolerated than bilateral movements like squats and deadlifts. So if you think about a squat, oftentimes the limiting factor in a squat or deadlift is going to be the lower back, right? Not the legs. But if we do a single-legged exercise like a step up, now the leg is more the limiting factor and not the spine, okay? And because of this, like I said, we are able to train the lower body without aggravating the spine as much, okay? In terms of dosing, so the hardest exercise on one leg for the spine is usually some sort of single-legged deadlift. This is because the torso is going to incline forward. We're creating a nice, strong moment arm for the hip, and that's going to increase stress on the spine. Now, if you can handle these things, great. If it's well tolerated, keep them in the program. But if you're having trouble tolerating single-legged deadlifts, you can try, let's say, a lunge with a longer stride, which is going to be a little bit more upright torso, right? Which generally feels a little bit better. And if that's still not feeling great, you can try, let's say, a goblet step up with a low box. And in this case, you're getting a lot of lower body strength work, but your torso is nice and upright and you don't have as much stress on the spine. Okay. So generally speaking, single-legged strength training is a very sneaky way to train the spine a bit. right? When you have low back pain, just because if you're holding a weight in front of you, let's say in a goblet, you still are firing the musculature in the core and the low back just to stay upright. So you're actually getting a decent amount of low back strength training, despite it being a bunch of leg exercises in nature. Number 4, anterior core work, right? This would be crawls, ab wheel, or plank variations, okay? Now, why do we like these exercises so much with lower back pain? This is your classic core stability work, right? And there is a ton of research on core stability work being helpful to reduce lower back pain. And here's the thing, you don't necessarily need to do core work in order to get out of low back pain. A lot of active approaches will help, but suffice to say, core work and stability work is very evidence-based way of reducing lower back pain and getting back to the gym, okay? The other reason why I like anterior core work is for extension-based low back pain folks, right? So in folks that have extension-based low back pain, their spine doesn't like to extend, right? And if we're working a bunch of anterior core muscles, we're working the muscles that help us to resist extension, okay? And that helps to build trust with our body. The spine can handle movements to extend the spine over load, okay? So when I'm trying to press something overhead, anterior core is very important to keep me from extending too much and irritating the spine. If I have a really strong anterior core, then my brain is probably less apt to give me pain because it feels like it has the strength and control over that motion, okay? Number 5, rotational core work. So this would be your renegade row or anti-rotation press. So why do I like rotary work so much? Well, it's great to work the obliques, the glute max, the lats, and the paraspinals. All these muscles can be involved when you have lower back pain, and it's a good way to start training those to get out of pain, right? The other reason why I like this so much, and it's not as specific to folks in the gym, right? It's more specific to folks that do rotary sports, okay? So the champion physical therapy and performance, we see a lot of baseball players. Baseball players end up with spiny injuries from a lot of hitting, right? So a lot of batting practice. And what probably causes these issues is a combination of extension and rotation. Okay. So we want to try to work all the rotary muscles in the core to help build trust the spine can handle movements that extend and rotate the spine under load. All right. It's going to build the strength and control where we need it. So reduce some of the stress on the low back in that area that's injured. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons. Going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain Free Mini Course. Definitely check this out.